I'm Malcolm Wyra, and welcome to another episode of Infocus. Tonight, we hold discussions with the United Nations Population Fund Country Representative Marielle Sander. We discuss the work UNFPA does in the country, the challenges confronting the organizations, its partnerships, policies, and programs, and future plans in the country. Marielle Sander, thank you for joining us.
Thank you for having me.
Firstly, Marielle, can you give us an historical overview of the UNFPA organization and its core missions around the world?
Yes, sure. The United Nations Population Fund, its acronym can be a little bit confusing. It started off as the Fund for Population Activities, but nowadays it's the UN Population Fund. We work in the area of sexual reproductive health and also population dynamics. So our work ranges from birth to census, you could say. And here in Papua New Guinea, our focus is to reduce the number of maternal deaths and to make sure that every pregnancy is safe, and to also ensure that young people reach their full potential.
So how long has the UNFPA been in Papua New Guinea?
We've been here for about 30 years. It's been a very long relationship with the government and the National Statistical Office, as well as the Department of National Planning and Monitoring, and of course the Department of Health, because you can't work on population dynamics without considering, how to make the birth and the delivery of new children safe.
PNG has one of the highest maternal mortality rates in the world. I think around 1,300 women are dying every year as a result of pregnancy-related problems. What interventions is UNFPA employing in the country to improve sexual and reproductive health in Papua New Guinea?
Thanks, Malcolm, for this question. There are many dimensions and a lot of interventions needed to resolve any challenges in this area. Let me just start with the health workforce. If we do a comparison between the populations of PNG and Australia, for example, PNG has just over half the population of Australia, and they have less than 600 midwives working now. In Australia, they have 24,000, right? So there's a huge discrepancy between the number of midwives available for women of reproductive age and the ones that and what they actually need. We recently had a health fest, like a big health festival, and in that we had a ball pit just to try to visualize the challenge for people who are not familiar with data. So we had a giant ball pit full of 3,750 orange-colored balls and one a purple color representing the one midwife to this entire population. And then people took it in turns to dive into this ball pit and find this purple-colored ball. And we have to do this because we need to illustrate to people, not just policymakers, why we need more investments in the health workforce, particularly in the area of reproductive health. And it's not just about the women who are pregnant, but it's also for the general population. Men have health issues as well, reproductive health issues. Not sure if you've been following the press, but also adolescents in the 21st century, they need to have the knowledge, information and access to services in order to protect themselves from sexually transmitted infections, including HIV, which unfortunately in Papua New Guinea is now on the rise. It's above 1% in the general population. So I was recently having a conversation with the head of UNAIDS, and it's something that's concerning all of the health agencies and the health partners in PNG. We need a stronger focus on sexual and reproductive health, where life is created in order to reduce the risk of death for the women, for the children, and for chronic diseases among the general population. I know that sometimes it's very challenging to have conversations about sexual reproductive health. I mean, even the word can cause people to be very nervous sometimes. But, I remind people here in PNG that, when I was growing up here 30 years ago, the body was not sexualized the way that it has become today. And there is a lot of good attitudes and practices, and in terms of like an easy relationship with the body that we could use today, so that people, the population, is not embarrassed about asking for help or asking for information or accessing the services that they need to keep the population healthy. I mean, just as another example, if I may, sexually transmitted infections like chlamydia or gonorrhea, they can easily be treated if a pregnant woman, goes to a health clinic early on. It's just it's very cheap medication, right? But if it's left untreated because of shame or stigma or ignorance, lack of knowledge, then it could result in a low birth weight for the baby, which could also lead to a premature death, or it could lead to chronic infections like blindness or other forms of chronic disability. And it's very sad that in the 21st century we are not able to prevent things that are so easily preventable. If we had enough health workers available, and if people trusted the health system enough, and of course, assuming that we have the supply chain. And this is also another area of our work, that we work with the National Department of Health to improve the delivery of reproductive health commodities across the country. And there's good news about that one too.
It's good you mentioned supply chain. I think the logistical challenge is quite a impediment to a lot of the work you do.
It's true.
So how is your organization, I guess, working to better improve your logistical expertise and expectations?
Well, I mean, I think it's important to note we don't do anything alone. We're working with the government on this, especially the National Department of Health, but also the provincial health authorities. Just as an example, last year, together with the PHAs, we conducted a survey of 160 health facilities across the country. That's 1/5 of all the health facilities available. So we understand the challenges, and in terms of supply chain, in terms of ordering the correct stocks and looking after them, making sure that the stuff that needs to be refrigerated is refrigerated. And of course the training and upskilling of the community health workers that are usually there. But what is interesting actually is also to understand the very basic issues around land ownership and also access to water. So it's not just the government needs to provide good health care. It's also the question that we need to ask communities themselves. How are you working with the government to make sure that the health facilities are well maintained, and what can you do yourself to make sure that the water is connected? I mean, we have to appreciate that Papua New Guinea is a fabulous country, enormously rich and dynamic and diverse, but we're still in development. We're not where we want to be. We haven't reached the full goals of the Constitution yet, and it requires the mindset, I think, amongst all of us here who have the privilege to work in PNG, that we all have to do our own bit to make sure that we're working with the government to achieve its objectives, right? Be careful with the resources that we put in. Make sure that we look after the facilities that are out there, and let's work together to make sure that commodities, essential medical supplies are delivered to the last mile. Right? You have to give 100% every day, not for yourself, but for the people that you serve. Service above self.
Thank you, Marielle. We now go for a quick break. Join us on the other side for more discussions. Welcome back. You're watching In Focus. Marielle, gender equality is a significant challenge in Papua New Guinea, as you touched on in the previous session. Given the systematic violation of women's rights in Papua New Guinea, it's quite prevalent around the country. The key indicator used to measure gender equality is the Gender Inequality Index. Could you give us a perspective and idea of the development indicator? The Gender Inequality Index is based on three sort of areas. One is reproductive health, access to reproductive health. The other one is women's empowerment, like the voice, right? And the third one is around access to the labor force. So these three areas are indicators are put together, and it gives the Gender Inequality Index. They use this because
it's the simplest, easiest way of seeing how much of a footprint women have in any country.
What other specific intervention is the UNFPA implementing in the country to foster gender equality?
Well, we work in different areas, and I've touched a lot on the health sector, which is one of the key, that's the core of gender inequality, because it starts at birth, right? It starts at how the mother is treated, the services she receives, and then of course as a child is born, she becomes socially conditioned. If it's a girl, for a boy things are different. The girl is more likely to drop out of school, and therefore she has less of a chance to enter the formal labour market, and her earning capacity is lower. And most likely she will bear children early, and this has economic consequences for her child, and for the family. So that's the connection between the gender equality and the health sector and reproductive health. But we also look at the health sector response to gender-based violence, which, as you mentioned, is prevalent, unfortunately, in Papua New Guinea. And usually when this conversation comes up, I fight back when they say, oh, it's part of PNG culture. It is not part of Papua New Guinea's culture. I was here 30 years ago. Yes, there is domestic violence. There was domestic violence in PNG then, as it is in other countries. But here, I think there are other stresses that need to be taken into account. Which is why a referral system to address the health response to gender-based violence is so necessary. So we've looked at the referral pathways, for example, working closely with the family support centres to make sure that if there's medical attention needed for sexual violence, for example, then the women have access to that, but also increasingly access to mental and psychosocial support, because there are many contributing factors to gender-based violence, and sometimes we need to examine our own sort of emotional response to this in order to have the strength to change the situation. So the mental health and psychosocial support is just one of these areas that we've invested heavily in, and we have 2 people now in the office that are specialized in this area of work.
How have you found the interest by public, or particularly the victims of feminine sexual violence?
Yeah.
How have you found the willingness to attend to those sort of services?
It's been very positively received by the people who need it, but also more generally, because we can't forget the importance of also providing support to the first responders, to the people who deal with the women coming for help. Just constantly having to work with people who are in trouble or traumatized is also traumatizing in itself. So we've found that the healthcare workers that work in the counselling area are also very grateful for the upskilling and the training that they've received. And frankly speaking, there are a lot of challenges in Papua New Guinea that learning coping skills, self-soothing exercises can really help develop emotional intelligence, so that you don't overreact to threats. Because there are different types of threats, right? There's there's threat of violence, which of course it's very different from being insulted or thinking that you've been insulted. But the reaction to all threats can very easily become a violent one when you're constantly under pressure. So that may be a contributing factor to the increase. Yeah.
One of the critical programs that the UNFPA runs is its UNFPA Population and Development Program. What are the primary areas of focus for this particular program?
Well, this is a really exciting program area for us, because it takes us back to sort of our origins around population dynamics and how to work with governments to better plan for its population. We've been implementing the data and population program in PNG, funded by the development partners, of course, but working very closely with the National Statistical Office. The most recent report is the Socio-Demographic and Economic Survey, which gives a snapshot of the socio and demographic well-being of the entire population. So we've done that. We're also working on a population situation analysis. We're doing a closer review of the demographic health survey to do a demographic profiling of each of these provinces, and we come up with policy briefs that each governor, each provincial administrator can use to get a snapshot of the well-being of its population, like on health, economics, access to water, access to education, road infrastructure, lots of different areas like this. So there's a lot of population data that is slowly becoming available as a result of this project that we've been implementing for the past 18 months.
Thank you, Marielle. We now go for a quick break. Join us on the other side as we look at some of the challenges confronting UNFPA in Papua New Guinea. Welcome back. You're watching In Focus. Marielle, what are some of the challenges confronting UNFPA, its activities and its operations in Papua New Guinea? I think you touched on a few earlier on, like culture and as well as the logistical challenges. Could you give us a broader perspective on the challenges confronting your activities in the country?
Yeah, the social norms may not be as challenging as you might think, because, as I mentioned earlier, some traditional practices were more open in the area of sexual reproductive health and the place for women in society, and sort of respecting the role of women and their contribution to culture and tradition. Today, the situation is a little bit different, but we can still leverage the impact of culture and understanding of culture in order to bring about the change that we want to see. So let me give you an example of this. Some of our work around gender-based violence and also sorcery accusation-related violence and attitudes towards reproductive health can be addressed through documentaries that we've produced. We recently, last night, we premiered 2 series on Papua New Guinea culture, one looking at the practice of tattoos and the reason, the thinking behind it, what the meaning behind it, which revealed the sense of belonging and also the sense of place and space that women had in the past. And that's something that we can use today to show that what we are bringing to Papua New Guinea now, when we talk about different types of modeled estimates for the population, to improved access to healthcare and the use of family planning, we can leverage the past to say that it's nothing new. You've had these conversations in the past, but perhaps you had platforms for that. They had house Mary dialogues, house man dialogues. Our opportunity now is to leverage these past platforms to again have conversations in a respectful manner, but to create the space and the platform for conversations that need to be held, because they were held in the past. We're just respecting that process and saying, okay, we'll build on what has been, on what we've learned in the past, to what we need to do now in the future for PNG.
Marielle, the UNFPA recently launched the Socio-Demographic and Economic Survey. How critical is such a survey insofar as development is concerned, and are you able to disclose some of the key findings from that survey?
The Socio-Demographic and Economic Survey is really interesting because it gives us some key figures on the population. For example, we know now that 56% of Papua New Guineans are under the age of 25. Another interesting piece of information is that 9.1% of girls aged 15 to 19 are or have been married, right? And that's compared to 0.9% of boys of the same age. So early marriage for girls is a challenge because that would mean that they would also start their reproductive lives much earlier before they have finished their schooling. And that will have economic implications for PNG's development. So it's it's useful to pay attention to data like this. Another data for women is that women 15 to 49, aged 15 to 49, have given birth to 2 children. So if they start their reproductive lives early, they are more likely to have more children. And we are already aware that PNG has a growing population, and we need to make sure that the idea of spacing children is widely accepted in the community, so that families are able to provide for the children that they have, for education and for health. The other key indicator that could be interesting to know is that 10.8 million people do not have safely managed sanitation. So access to a proper toilet has increased, but we're still facing an enormous number of people who do not have that level of access that they need. So it's just like little tidbits of information in the socioeconomic survey that could be very useful for provincial authorities as they plan their interventions, and also for the government at a national level as they determine which areas to prioritize.
Thank you, Marielle. Recently, the world and Papua New Guinea celebrated the World Population Day. It was recently celebrated on the 11th of July. Why is commemorating such a topic or such an issue important for the world and the country as a whole?
Well, the 11th of July, it's a great opportunity to celebrate the 8 billion people that are now in the world, and also to shine a spotlight on population issues, to encourage people to get familiar with data and understand what it means for them, and how the data will impact the choices that their elected representatives will make to make their lives better. Population issues are often underappreciated, but very important in terms of determining the future of your family and the future of your country.
Marielle, finally, are there any concluding remarks you'd like to make, specifically given that it will be your end of your tenure soon and you'll be taking up a post overseas? So are there any parting remarks you'd like to make?
Yeah, my passion for Papua New Guinea will always remain. This is the home of my childhood, and I carry a part of Papua New Guinea with me wherever I go. But in terms of the team that I leave behind, my hope is that we continue to carry our work to the last mile, to reach the people furthest behind, and that means the very remotest parts of Papua New Guinea. To the greatest of our ability, we will continue to do this in PNG, and I'm so proud and happy to have had a chance to come back and do my best for this wonderful country.
Thank you, Marielle. Unfortunately, we have to leave it here. It's been a very educative session. Before we go, I'd like to take this time to thank our special guest, Ms. Marielle Sander, Country Representative for the United Nations Population Fund. Marielle, thank you for joining us.
Thank you.
That's all the time we have for this edition of Infocus. Join us again next week, Monday.